And Ken, I'm going to start with you. Former Congressman J.C. Watts used to say that we needed to create a department of unintended consequences for all the bills that were passed. And I think that Obamacare ranks up in the unintended consequences department. So let's talk about unintended consequences.
Well, it's really hard for me to talk about unintended consequences around Obamacare because I actually think the consequences that we're experiencing are part of a deliberate strategy by the Obama administration to fundamentally take over that section of our economy. Probably from their standpoint, they have assumed that the American people are asleep at the switch. And what CPAC and organizations that are affiliated with this forum know that American people are wide awake and we are brighter than the administration gives us credit for. Look, if you go back over the whole span of human history and you look at authoritarian regimes, totalitarian regimes, or big welfare states, they've had to do a couple of things. They've had to destroy the family and they've had to silence the church. As we take a critical look at Obamacare, organizations that understand that families should be, as the Congressman just indicated, in charge of picking their health care, and churches that actually understand the moral outrage and foolishness associated with Obamacare, this administration has tried to silence. We are not going to be silent. We are ready to push back, and that is perhaps an unintended consequence for Barack Obama.
Senator Barrasso, thanks for joining us.
Thanks for having me.
Unintended consequences.
Well, first, I think that Harry Reid has been watching the CPAC schedule, because when he saw that this was scheduled to start with you as the moderator, Amy, at 11:15, he scheduled a vote at 11:20. And I said, I'm going to be here to talk about the truth about this health care law. And you're hearing true stories all around the country, as Tom and I was listening on the live stream on the way over here. But there are incredible unintended consequences of the health care law. Tom, you talked about some of them, and Ken about loss of jobs, cut back in wages. I mean, it's affecting reading teachers, 911 folks, people that are working. It's hurting middle-class Americans all around the country. There's a lot of money for IRS agents in this, but not enough money to train the physicians to take care of the patients. You just referred, Ken, to the good book, the Bible. There's the proverb, physician, heal thyself. Obamacare is patient, heal yourself. You're on your own in many ways. People are going to be, they're going to healthcare.gov, and instead it's going to have a direct link to WebMD. Yeah. They got to call a friend, check with
phone a friend.
Check the whole audience if you want an answer. I mean, these are the problems with this. There just aren't enough people to take care of the patients, and it's actually making things worse. Those are the unintended consequences. If we look for a positive, the positive is that with American ingenuity, with apps, with understanding of more about us, we're going to go patient-centered with the technology, even though the healthcare law goes more government-centered, which is not helping patients get better.
Thanks. Alex, I want to make sure that we talk a little bit about the college students, because this is important. 2008, they were not of voting age to vote for President Obama, but they voted for him overwhelmingly in 2012. So is Obamacare, is this going to change their mind, the Obamacare? Are you going to use, is the GOP going to use it as a tool, as a recruiting tool for college students? Give us some thoughts on that.
Sure. So in 2013, the College Republican National Committee actually did a fair amount of research on youth voting behavior in the 2012 elections. It's a 90-page report. You can find it on our website, crnc.org. But what we found in 2012 was that young people weren't necessarily sold on the president again, and they're not sold on liberal policies, but they didn't see an alternative with us. They didn't see us as putting forth new ideas to which they could relate. And going forward, we need to make sure that we are communicating in a positive way what those ideas are, where younger voters are. I'll give you an example that I think mirrors the healthcare debate at this point. In 2012, of course, and it's still the case, the economy is terrible for young people, and it was as of Election Day in 2012. Youth unemployment was double the national average, 3 in 10 millennials moving back in with their parents. Young people not entirely sold on the idea that the president was improving the economy, but they still voted for him to the tune of 5 million more votes over Governor Romney. Where's the disconnect there? The disconnect comes from not having a positive vision communicated directly to them. And in fact, in the focus groups that we did, the #1 word associated with the president and the economy was trying. President gets an A for effort, wins the election. Why? Because he communicated with young people. He communicated where they are with a positive message. And young people respond to that. The same is true of healthcare. We have to stand up and say no to things that are harmful for this country, especially for the things that this generation will pay for. But at the same time, it can't be the only thing that we say. And again, going back to the economy in 2012, that's really all we did say. We said no to President Obama. We said no to his policies. But we didn't really offer an alternative. So we need to offer that alternative, and it's important that we offer it where young people are. That means going online, talking about digital strategy. There are a couple panels that talk about that here. But it especially means going to campus and having that courage to do so. If we're not communicating our ideas on campus, we leave it on the shoulders of college Republicans out there to do it for you. So, candidates and campaigns, we need to be mindful.
We need to do a better job.
Yes, of going out there and helping out those CRs get our message out on campus.
Absolutely, thanks. Senator Barrasso, I want to go to you. The famous, we have to pass the bill before we see what's in it. Obamacare, the bill, like an onion. We peel the layers of the onion, we cry. We peel the onion, we cry some more, we cry some more. What are the bombshells that we haven't peeled away those layers? What are we going to see that has not yet come out, that has not been covered by the media?
It's a couple of things. One, with the cuts to Medicare Advantage, I think it's going to be harder and harder for seniors to get to see a doctor. Going to get harder to get to a doctor. You see hospitals that are just not wanting to take this. And in New Hampshire, 10 of the 28 hospitals, people are not included in any of the exchanges. You talk to Kelly Ayotte, the senator from New Hampshire, who to me is a Republican superstar. She will tell you that there's a hospital there where the chief of staff of the medical staff can't even go to their own hospital. So you're going to have it harder and harder to get care. People are going to have to go further away, harder to get a doctor. The president is desperately trying not to fix the health care law, but to save the election. I mean, the headline on the Hill yesterday, new Obamacare delay to help midterm Dems. Not to help patients, not to help providers, not to help taxpayers of this country, but to help midterm Dems. Even the New York Times this morning put it as it relates to the elections only, because they don't want this next group of 6 million people to get cancellation letters. They were going to be coming this October had the president not done one more of his now over 2 dozen delays.